Hello everyone, my name is Masami Yoneyama. I am a clinical scientist working at Philips Healthcare in Tokyo, Japan. Together with my colleagues and collaboration partners, I develop new imaging technologies for clinical diagnosis, for disease detection and monitoring. On the day when the Berlin Wall fell, I actually don't recall what I was doing exactly, but like many middle school students, I was very curious about computer science. So I must be playing computer games so hard at that moment. As a child, I wanted to become a doctor, and sometimes I also wanted to become a scientist. Now, I work with doctors together to improve the patient care, and I work with my colleagues together on new inventions to drive science and research forwards. So yes, this has come true, and it is just perfect. In my work, very often you realize that imaging or scanning a child is such a big challenge. In particular, if you want to check for any vascular diseases, you always have to inject a contrast material for visualization of the blood vessels. Even for magnetic resonance imaging, (MRI), which is normally considered non-invasive because no radiation is used, still a small cut in the skin needed. This is invasive, extremely uncomfortable for the kids. This is costly in both money and time. Also, good image quality is not always guaranteed. What I address in my project is exactly the challenge to ensure high-quality, time-efficient vascular examination in children using MRI with no need for contrast injection. I call this solution, or this new technique, REACT. The breakthrough innovation is really about how to overcome the bottleneck in MR signal and contrast to be able to obtain good physical signal from the blood, at the same time to get rid of the signal from the background tissues to generate sufficient contrast for the vessel at the end. In the MR images, different tissue types present different signal intensities because they have different physical conditions and chemical environments. Now, there are several technical components that are critical in React MRI. They are all achieved by controlling and combining the high-frequency pulses and magnetic gradients in a specific way. First, we apply preparation pulses in such a way that the signal from muscles, nerves, and internal organs have similar amplitudes and all inverted. We start to acquire the signals at all the time when they come across the so-called nulling point, where these signals are invisible and not contributing to the final image. In addition, during signal receival, we acquire two MR records to separate the signal from water and fat. In this way, when we look at the water images, no fat is present, no signal from other background tissues like muscles and organs is visible, and only blood vessels are shown in the final image. It is a nice way to scan the body vasculatures. You can apply it in almost anywhere in the body from neck to toe. Furthermore, by acquiring additional signals when the blood signal is across the nulling point, We can even get dark blood images that delineate the vessel wall structure simultaneously within the same scan time. The obtained information can help us detect a region like thrombus. React MRI has now been used routinely in a few hospitals. Less children have to be scanned with contrast injection, and children with vascular disease are more easily examined. Operators or technologists can scan the kit with less stress, and they can spend more time in communication with them. The great thing is also doctors can decide on the fly which part needs to be repeated. This is not possible at all in a contrast injection scan. At this moment, React MRI allows a good visualization of both artery and veins, but sometimes doctors would like to see the arteries and the veins separately in the images. I believe there are potential solutions out there, even with the emerging artificial intelligence. Actually, we are already working on some of them. Everything is possible and exciting here.